This is Matthew. He's had a history of chronic calf pain. It started after he had an ATV accident about 5 years ago, during which he had multiple puncture wounds and had his muscles stitched together. So since then, he's had pain, decreased flexibility, and muscle strength. We're going to take a look at his flexibility before we go ahead and needle him, and then we will assess after the technique to see if it made any difference. Okay, go ahead and push your toes up. Good job. As you can see, the right side is significantly lower than the left side. Okay, all right. Very fine needle. This is one of the needles that we use for dry needling. We insert with a very quick tap into the muscle. So like this right here would be, and then we go ahead and peck the muscle or have multiple insertions. If you could see that, that is what we call a localized twitch response, where the muscle kind of twitches with the insertion of the needle. That is one of the reasons that kickstarts the healing process in the muscle, decreases pain. It helps relax the muscle, resets it, and improves the channels of communication with the brain. I'm going to keep doing that a few more times and try to get as many twitches as I can. Okay, and then I'm going to leave it in there for a few minutes. So there were multiple trigger points on his calf muscles, so I'm going to go ahead and put another needle in there right beside the one we had in first. Again, go ahead and peck the needle into the muscle a few times, trying to get a twitch response. And leave it in there. So after dry needling, we're going to go ahead and reassess the muscle, see if there has been any improvements in the flexibility and range of motion. So go ahead and pull your toes up. Very good. Okay, so one of the immediate benefits of dry needling, as you can see, is an improvement in flexibility or range of motion of your muscle. Your muscle tends to feel a little fatigued after you've been dry needled, but that is part of the healing process. So that was our little demonstration. If you guys have any questions regarding dry needling, feel free to contact Wordis Therapy. Hello everyone, my name is Ritu Kanuga and I work as a physical therapist for Wordis Therapy. I was here today to talk about dry needling so that I could give you guys some information and also a little demonstration of the technique. Dry needling is a technique in which a therapist inserts a very fine needle into a trigger point on a muscle. A trigger point is a knot or a painful spot on a muscle that causes a lot of soreness, weakness, pain around the spot, or it can also shoot pain along other regions of the body. By inserting the needle into the trigger point, we are looking to stimulate the muscle, make it twitch, which kickstarts the healing process and is responsible for bringing down the pain. Now, the most common question is if dry needling is similar to acupuncture. Well, we use the same kind of needles for both techniques, but the intent and the core philosophy of both techniques is very different. Acupuncture is based on traditional Chinese medicine, so they insert needles along energy lines or meridians in the body that look to unblock the energy flow. So the area of insertion could often be far away from where your area of pain is, whereas for dry needling, we insert the needle directly into the trigger point, so you're going to be needled right along the area of pain. The benefits from dry needling are often immediate, so you might feel an increase in flexibility, improved range of motion, decrease in pain, and sensitivity in your muscle.